Hi. If you or somebody that you know have been diagnosed with lung cancer or lung metastasis, you're probably searching a bunch of different options. You probably already got a lung biopsy, or you're planning to undergo a lung biopsy to make the diagnosis. But if you have any questions about that, you can watch this video. But what if I told you you could treat this cancer or these tumors in a way very similar to the lung biopsy? So in this video, I'm going to talk to you about cryoablation of lung cancer and lung metastasis. So lung cancers are traditionally treated with a surgical resection, and I think to the day this is probably the best option. However, not everybody is a surgical candidate. Some patients don't have enough lung that can undergo a surgery. Well, recently there is good data that other alternative treatments like stereotactic radiation can be as good as surgery for very small tumors. More often than not, they require a biopsy and also placement of a fiducial marker, which is a little gold seed that we implant in this tumor so the radiation machine can focus on that. They also don't always work, and there are recurrences associated with that. And if you have a recurrence, usually you cannot have radiation again, or there's a limit to it. So that's why some patients may need something else, and that something else can be a cryoablation. Cryoablation is a cutting-edge technique that uses extreme cold to destroy the cancer cells. This treatment is performed by inserting a thin, specialized probe called a cryoprobe, which is a needle, basically like a needle biopsy, directly into this tumor. The probe can then deliver a very cold gas called helium and creates an ice ball that freezes and kills the cancer cells without destroying much of your normal lung. Over time, the body naturally processes and removes the destroyed tissue. This procedure is very precise, making it a great option for treating tumors while preserving healthy lung tissue. It's often used for patients with the small localized lung tumors, particularly when surgery isn't an option. Let's say you have 3 or 4 lung metastases. You're not going to remove 3 or 4 big pieces of your lung, and they're often small and difficult to find during the surgery. So for those patients, cryoablation may be a great option. And there is a bunch of good data about this. Let's talk about it. I also want to mention there are other types of ablation that can be done, including radiofrequency ablation or microwave ablation, but those in general are considered a bit more dangerous in the lung. So who would be good candidates for the cryoablation of lung tumors? So patients with early stage lung cancer who are not candidates for surgery due to other medical conditions or age, especially lung conditions. Patients with a metastatic tumor in the lungs where cancer has spread from another part of the body, or patients who had radiation to a lung tumor, for example, and the radiation failed. Of course, this is often a team decision we discuss between the interventional radiologist, the lung surgeon, and the oncologist to decide what's the best option for you. So how is the procedure actually done? So the cryoablation procedure is very similar to a lung biopsy, and indeed sometimes we can do it at the same time that we do a lung biopsy. So we do these procedures usually with a mild sedation, so you're not completely under general anesthesia, just twilight sedation. And we usually do these procedures guided by a CT scan. So you'll be laying in the CT scan table, and initially we'll get some images to identify the tumor or the tumors we're treating. Although we can often treat more than one tumor at a time, we usually prefer to treat one lung at a time. We don't usually do procedures in both lungs at the same time. Although in some cases we can actually do that, being very careful, of course. Then, using CT guidance, we then insert the cryoprobe, which is actually not any different than a biopsy needle. It's actually a little smaller, and we insert that through the skin directly into the tumor. We then, once the probe is in perfect position, we deliver a very cold gas called helium, creating an ice ball around the tumor. And we can actually see real-time the ice ball forming around the tumor, so we can have a pretty good idea how much tissue we're actually freezing. This process then freezes the cancer cells, cutting off their blood supply and disrupting their structure. Although the insertion of the needle is usually quick, the procedure of freezing the tumor usually involves a few freeze-thaw cycles to ensure complete destruction of the tumor cells. The entire process is performed with incredible precision, targeting the tumor while minimizing damage to the surrounding healthy tissue of the lung. Because the freezing process takes at least 30 to 40 minutes, the entire procedure usually takes about an hour. And because it's minimally invasive, most patients will go home the same day or the following day, depending on how they're doing. And the recovery time should not be any different than the recovery time of a lung biopsy. So it's usually a pretty well tolerated, straightforward procedure. What are the advantages of the cryoablation? Well, compared to surgery, it's a minimally invasive therapy requiring no incision. The recovery time is not any different than a lung biopsy. It's highly targeted at reducing the risks of damage to healthy tissue. And it can be repeated if needed as many times as you need. So what are the possible complications? Yeah, of course there are complications associated with this procedure, although cryoablation is very safe when performed by experienced interventional radiologists. The most common complication, like a lung biopsy, is the risk of a pneumothorax or a lung collapse. And any time that you put a needle in the lung and you take the needle out, some air can escape from the lung and get trapped between the lung and the chest wall. And if you had a lung biopsy or you heard about it, you are very familiar with this process. The risk of a pneumothorax is about 10 to 20%, and it's very manageable. But if you do have a pneumothorax, what we have to do is we have to insert what's called a small chest tube. It's a little straw that we put in the cavity around the lung to remove the air so the lung can expand again. But if you have a chest tube, you will need to stay overnight. We then need to keep the chest tube until that little hole in the lung is completely closed. And that process usually takes about a day, and in very rare cases, 2 days. It's very rare that you would need another intervention to fix the leak. But you're wondering, what is the data and what's the success rate? So this is a procedure that actually has been pretty well studied. There are 2 relatively large trials that evaluated the efficacy and safety of this procedure, and they are called the Eclipse and the Solstice trial. The Eclipse trial showed success rates of approximately 95% in 1 year, 90% at 3 years, and 85% at 5 years. The Solstice trial also evaluated the effect of lung cryoablation for lung metastasis and showed an efficacy of 80% at 2 years. But after a second procedure, a second cryoablation procedure for recurrent tumors, this success rate improved to 91% at 3 years. Now, like I mentioned before, the rate of pneumothorax requiring a chest tube placement was about 20% in all these studies. So what to expect after the procedure? After the procedure, it's common to have some mild soreness or discomfort at the treatment site. The soreness or pain is more often when these tumors are actually close to the pleura or close to the chest wall, because that's where the nerve endings are. You may also experience a temporary fatigue or a slight cough, especially if the tumor treated was near an airway. But the symptoms should resolve within a few days. It's also common to have some blood in the sputum for a few days up to 2 weeks, but it should be a small amount of blood. Obviously, if it's a large amount of blood, you need to let us know. Patients should be able to shower the same day or take a bath, but we usually recommend avoiding heavy exercise for a week or 2 after the procedure. As I mentioned before, there's really no wound care because there is no wound, there's no cut. Most patients can resume normal activities within a week. Follow-up imaging, such as a CT scan. So what happens with the tumor after the ablation? Does it disappear? Well, this is a very important question to understand. So what happens when you freeze these tumor cells is that they are destroyed and they fracture and they fall apart. And the components of that cell are then absorbed by the inflammatory system. And that's one of the reasons why people are really exploring whether or not combinations of ablation and immunotherapy might be a new opportunity in terms of treatment of lung cancers and metastases. But the important thing to understand is that the imaging appearance is not going to go away immediately. Indeed, if you repeat a scan the next day or in a couple of weeks after the procedure will likely look a lot bigger than before because we treated the tumor and a little bit of margin around the tumor. But that's why you need to understand the procedure and understand the imaging afterwards. And that's because these areas that are treated, although they may look bigger in a regular CT scan, these areas should not take up any PET contrast. So they should not be hot on the PET scan. And that is how we know that our treatment has worked. I know you also have questions about insurance. It's a big problem these days, but in most cases, cryoablation is covered by the insurance. But it's always a good idea to confirm with your insurance, and my team will obtain pre-authorization before the procedure. I hope this video has given you a better understanding of cryoablation for lung tumors. It is a minimally invasive, safe, and effective option for many patients, offering precision treatment with minimal recovery time. If you think cryoablation might be a good option for you or somebody you know, talk to your oncologist and see if it's a good fit for your specific needs. If you have questions or want to learn more about this, feel free to reach out to our office.